Amnesty International South Africa is calling on government to urgently act on the Hammanskraal water crisis following the deaths of 15 people. 34 people are still in hospital with cholera in that area. The Deputy Health Minister telling eNCA a short while ago they're keeping an eye on cases in the Free State town of Parys and also on a case in Limpopo as well. He's flagging a concern that there may be more deaths in Hammanskraal from cholera that have not yet been picked up as such. The city of Tshwane says one of the 3 plants that supplies water to that area, Temba, has tested free of cholera. But the mayor telling us just in the last hour that residents must still boil or disinfect their tap water until all test results are returned and they can definitively pinpoint how cholera has spread through this community. Well, let's speak now to Alicia Jooste, Senior Program Officer at Amnesty International South Africa. Alicia Jooste, thank you so much for joining us. Hammanskraal has a long history of failing its residents in terms of clean drinking water. When you look at what's been happening there in the last few days and the way government is managing the current crisis, what are your thoughts?
Good evening, Sally, and thanks for having me on, and good evening to your viewers as well. So as you said, we know that the area has been battling for access to safe and reliable water for years. And so in large, what we are seeing is the consequence of that. And what we know in South Africa as a whole is that there are about 20 million people who do not have access to safe and reliable water and 14 million people who do not have access to basic sanitation. And so this makes us susceptible and vulnerable to outbreaks that we're seeing now. So this can't be treated as a once-off incident, but a wake-up call for the government to ensure that all communities across South Africa are protected from diseases like this. It's also a wake-up call as to what can happen when the government does not have the necessary interventions in place to detect cholera in a timely manner and then to respond to outbreaks without it leading to the loss of life. We know cholera is a preventable and an easily treatable disease, so what we're seeing transpire is completely unacceptable.
We have seen the health department, ever since the first case of cholera was picked up in South Africa, being quite on the front foot about saying, look, there is cholera, please be careful. But it does seem that when a disease like cholera meets inefficient water supply systems, we have a real problem on our hands. Perhaps no surprise that Hammanskraal has become a victim to cholera. If we look back at the history, just go through where government, and we're talking not just local, not just provincial, not just national, not just ANC, not just DA. We're talking a conglomeration of different political figures and administrations and levels of government that seem unable to fix this problem. What is your take on that?
Exactly, and I think we have to ask whether they're unable to fix the problem or whether there has been a lack of political wills throughout the year to fix the problem. As we know, and as I've said, this is a preventable and easily treatable disease. So I think that begs the question as what are the barriers to governments not being able to treat and to hear the warning signs of the residents in the area, to hear them speak about the smells that they have to deal with every day when it comes to access to water and that drinking water. It just sounds like they're not listening. And as I said, this is a consequence of that lack of political will throughout the years in listening to poor communities in South Africa when they say, and they give us these warning signs that access to water in their communities is not available, or safe access is not available. And I think that's why we need as a nation to look about how are we holding these different administrations to account when we know that every person deserves access to safe, sufficient and reliable water. At the end of the day, the buck stops with the Department of Water and Sanitation in working with municipalities to ensure every person has access to safe water and basic sanitation.
We have seen, spoke to the mayor of Pretoria in the last hour, and he's saying this is something that's beyond our budget to fix the Rooiwal water treatment, which has been a problem for years. There's also been the typical corruption problems, people walking off site when contractors were employed to do things. But he's now saying that unless national government works together with the municipality, they don't have the budget and they don't have the capacity to fix this. What action would you like to see government taking? You have slammed them. You said they've not done enough. What should they be doing now that they're not?
So firstly, I think there must be ongoing transparency on this issue. All steps taken, as well as information on the source of the outbreak, must be communicated publicly and clearly, so we know what's actually going on the ground. And as said, I think it's disappointing to hear that. I think when people have lost lives, I don't think it's up to us to solve the problems. The government does need to come together. It does need to be every facet of government coming together to see how we can stop and further prevent a loss of lives. Now is the time for the department to act so that it doesn't start spreading through other areas of the country. So what this looks like, this must be an ongoing and emphasis there on ongoing, multifaceted approach to the prevention and control of cholera. This includes the surveillance of water and sanitation facilities and services, and ensuring there is readily available treatments of the disease. This can't stop once this outbreak is under control, but it is the responsibility of the Department of Water, of the health departments, of municipalities to ensure that this monitoring is on an ongoing basis. As I said, this has become a life and death situation that needs immediate and urgent attention.
Thank you so much for speaking to us this evening. That was Senior Programme Officer at Amnesty International South Africa, Alicia Jooste.